us Dr. John Ward, who oversees the CDC's National Viral Hepatitis Strategy, and he's going to be talking about the implementation of the Viral Hepatitis Action Plan. Thanks, John.
Thanks, and good morning, everyone. It's great to see all of you. It's really great to have my HIV colleagues and viral hepatitis colleagues all together in the same room. It's really been a fantastic meeting, and I want to thank Veronica Miller and all of her staff for getting us together and talking about testing and linkage to care and doing a better job of saving lives that otherwise would be lost to viral hepatitis and HIV. One of the positive developments over the last several years, in my opinion, has been the development of an HHS action plan for viral hepatitis. And I was asked to give you a brief overview and a little bit of an update as to the progress in implementing that since it was brought together. This was really an outgrowth of an Institute of Medicine report that came out in January of 2010 that identified a number of deficiencies in the way the nation was responding to the growing morbidity and mortality related to viral hepatitis, and outlined a number of action steps, one of which was a call for greater national coordination of prevention, care, and treatment activities. In response to that, the Assistant Secretary of Health, Dr. Howard Koh, tasked HHS agencies and offices to bring together an action plan for viral hepatitis, and I had the privilege of working with Rosie Henson to co-chair that effort along with a variety of experts throughout HHS. In addition, we solicited input from other agencies with relevant expertise, such as the VA and the Bureau of Prisons and the Department of Justice. We, on 2 occasions, sought public comment. We then went through a formal review process within an HHS, and what came out of that is an official action plan for viral hepatitis, really representing the first national plan for viral hepatitis prevention, care, and treatment. Within that document, which I hopefully if you don't already know a lot about, please go and look on the HHS website, assigns a number of activities to agencies, either as a lead agency or as a supportive agency around particular goals through 2013. And as I see here, this was released in May of 2011. Overarching, there are some goals that are recognized to be of value. Some of these are our 2020 health goals for increasing the proportion of people who know their status from hepatitis B or hepatitis C, reducing HCV incidence, and achieving the national goal of eliminating mother-to-child transmission of hepatitis B virus. The action plan implementation is led out of the Office of the Assistant Secretary of Health by Dr. Ron Baldessari and by Karina Dan. A viral hepatitis implementation group has been formed with representatives of the various HHS agencies and offices. We've met on at least 8 occasions. Others participate, such as Janet Durfee from the Veterans Administration Hepatitis C program, and we've had at least one community stakeholder meeting that was held this past June, and the OASH has recently released a 1-year progress report that's available online, and some of my highlights will be coming from that report. Now, we didn't receive a lot of resources to implement this plan, and we already are, resource challenged within the viral hepatitis prevention. So we looked for other ways of being effective, such as recognizing the coming reforms within the healthcare system, the changes in health information technology that presents opportunities for clinical decision tools and performance measures, promoting integration within existing programs and other plans, such as the National AIDS Strategy, augmenting capacity at the state and local level, recognizing that we need to know more, so setting a research agenda, and with all of this, recognizing that we cannot do this alone and we always have to be reaching out for partnerships. The plan is organized into 6 issues, one around education of the public and providers, improving testing, care, and treatment for persons living with chronic hepatitis to prevent liver disease and cancer, strengthening surveillance, eliminating vaccine-preventable viral hepatitis, recognizing that injection drug users are a particular high-risk population for all forms of hepatitis, and recognizing that we have a major problem in healthcare settings now, particularly for hepatitis B and hepatitis C. Some of the highlights, I think one of the areas that really has been very fruitful is development of educational programs, both for the public and for providers. At the public level, we launched a No More Hepatitis campaign that was kicked off at a White House event. It is an official HHS campaign that really seeks to increase the general awareness about the silent epidemic of hepatitis while having specific communication objectives around hepatitis C prevention, such as targeting baby boomers, and for hepatitis B, targeting Asian Americans. And this campaign is being disseminated by various agencies, as I've shown you a few examples are. The plan also designated May 19th as Hepatitis Testing Day, which was the first health event of that type in the United States. We recognize May 19th because it's my birthday, but and also because it was the previous World Hepatitis Day that was moved by the World Health Organization to July 28th. But we had a very good beginning of Hepatitis Testing Day, and we really look forward to building that health observance, given the large proportion of people who are unaware of their status in the United States. Also, as part of the campaign, we've had 2 World Hepatitis Day events at the White House. This just gives you an example of some of the promotional materials from this campaign. On the provider side, we all recognize, and we've been hearing this morning about the huge challenge of getting the workforce prepared and to meet this growing burden of viral hepatitis morbidity and mortality. And so we've worked very hard to bring together educational materials, develop curricula, disseminate that curricula to community health centers and Indian health service providers, develop web-based training through the University of Washington sponsored website, developing guidelines for patient management, both for general practice as well as for drug treatment centers. One other important aspect of the plan is improving testing and linkage to care. And we've been talking a lot about the birth cohort strategy, and that was developed, since this plan has been released. We've all been, hopefully, are cognizant of the large burden for this population, its high prevalence, the large proportion of people are unaware of their status, and the benefits in reducing all-cause mortality and liver cancer when one is tested and linked to appropriate care and treatment. The opportunity that's presented in the plan is to coordinate and align federal policies so that they're understandable by providers. And the opportunity that's in front of us now is that we have the CDC policies for both risk-based testing as well as for birth cohort-based testing, and now we have the U.S. Preventive Services Task Force recommendations that have come out that, on a positive note, also recognize the benefits of testing and linkage to care using both risk-based and birth cohort-based strategies, but there are some alignment that needs to be achieved regarding how the strength of evidence is viewed across these 2 different processes, how the health outcomes are viewed across a grade B and grade C, their definition of risk categories, and others. And I think perhaps, one activity we could really have, after having gone over this draft recommendation last night, I think we could really have a journal club to go through this document. And if the forum wanted to host a teleconference to have a journal club on this, I would be happy to participate. And we have an opportunity. So let's do that. And then we have an opportunity to comment through Christmas Eve. Examples of other activities in the plan. is surveillance. We've had some very fruitful discussions with HRSA regarding how we can begin to link their community health center databases with our surveillance programs, increasing the efficiency of our surveillance activities. Medicare has just issued a notice in the Federal Register to expand Medicare coverage for hepatitis B vaccination for persons with diabetes, following the CDC ACIP recommendation in that regard. We've successfully had NQF, the National Quality Forum, adopt a measure for hepatitis B birth dose coverage for all birthing facilities in the United States. That came out in May of this year. For persons who inject drugs, there's really a fairly host of activities, and I think there's really a number of prime opportunities to integrate prevention throughout a variety of programs and even build on some collaborations through some discussions that were convened by the Assistant Secretary of Health Office between CDC, NIDA, and SAMHSA. So I think in looking over the implementation of this, I think the action plan has been beneficial in raising the profile of viral hepatitis within HHS and within a variety of stakeholders. It has helped us set priorities. It does provide a measure of accountability that agencies are, as evidenced by the plan, by the one-year progress report. They are asked to describe what activities they're doing to achieve the objectives of the plan. And it really helps us build relationships. It does bring us together. We definitely work more across agencies now because we know each other better. We meet more frequently, and that bodes well for the future. Speaking of the future, the issues going forward is that we have implemented some activities in response to the plan. The issue is, do we have the resources to sustain those and resources to implement the other activities that are called for in the current plan? That's always an ongoing challenge. Also, the current plan only goes through 2013, and so that's fast approaching. So we really have to begin to assemble the resources, both personnel and otherwise, to update this plan for future years, because we're really entering a brand new and very exciting era for viral hepatitis. The Affordable Care Act will be fully implemented in 2014. We have a host of new therapeutic agents for hepatitis C, which bodes well for an all-oral regimen that will help us prevent disease and almost certainly transmission as well. And the list of those opportunities go on. So I think everyone, I call on all my federal colleagues to stay engaged in this effort, to see through the current plan, and let's work together to continue this strategic planning for future years. Thank you.
Great. Thanks very much, John. Again, the forum is a great opportunity to get leaders from a variety of different fields together. Following the CDC perspective now, we're pleased, as we heard before, to have Grant Colfax, and hopefully he'll have his slides so that he can talk with